It's one of the most common medical conditions facing Americans. In fact, according to the National Institutes of Health, 8 out of 10 people will suffer some form of back pain throughout his or her lifetime. Back pain can range from a dull, constant ache to a sudden, sharp pain. It can last a few days, months, or even years.
Some of the most common causes of low back pain involve either a muscle strain or sprain. In addition to these injuries, a patient can have just normal wear and tear of the low back and become arthritic.
No matter how agonizing or how long it lasts, one thing is certain: back pain is very disruptive to a person's life. Mike Davis knows all too well the burden of back pain.
I was very limited with just about everything on a daily basis. I couldn't sit for very long, couldn't stand for very long, had a hard time walking, had a hard time doing just about anything.
When it comes to treating back pain, a doctor can decide the appropriate therapy based on a patient's symptoms. Some patients can get relief through medications, while others may require surgery. But as emerging research indicates, back surgery is not always the solution.
Unfortunately, failed back surgery is more common than people believe. It is estimated between 10 and 40% of all back surgeries in the United States fail to relieve the patient's pain.
Today, there are new techniques that can greatly reduce pain without invasive surgery. This new breed of minimally invasive treatments is emerging as one of the best options for those who don't want to go under the knife.
They're usually safer than the surgical procedures, and they cost less, and quite often able us to achieve the same goal as the more invasive surgeries, alleviation of the patient's pain and making their life easier and productive.
Mike opted for a treatment called radio frequency ablation for his severe back pain. Thanks to these new innovations, his back is now pain-free.
My quality of life has improved dramatically. It's been night and day. I am thankful that I've actually found something other than an operation, and it's something that I would highly recommend. It's absolutely night and day difference. One of the specific things that I can do now that I wasn't able to do before was actually fly. My job takes me on an airplane just about every week, and flying anything other than an hour was very painful. It was almost excruciating. I had a hard time getting out of the plane. Now I can go, take my flights, drive anywhere. I'm not stuck in one place and feel like that if I don't move here real soon, I'll be stuck there forever.
I would advise somebody with low back pain to seek out the advice of their primary care physician and become educated to other forms of treatment that are available to them. Fortunately, greater than 90% of back pain will resolve with conventional treatment and non-surgical intervention. Treatments that include rest, ice, medication management, injection therapy, physical therapy, and other cutting-edge technology have all helped us alleviate low back pain without a surgery.
The professionals at the Pain Management Center at Centennial Medical Plaza are dedicated to alleviating chronic back pain. Led by Medical Director Dr. Michael Gasquire, this team of specialists is committed to identifying the source of back pain and determining the best course of treatment.
The goal of our Pain Management Center is to provide a patient with comprehensive treatment plan. We combine patient education, the most advanced techniques, and cutting-edge technology, informing this plan and having the patient become actively involved in their care.
The Pain Management Center offers the newest and most promising minimally invasive treatments for back pain for those who are seeking an alternative to back surgery or have had one or more unsuccessful back surgeries. One treatment, radiofrequency ablation, kills the nerves at the source of the pain.
Radiofrequency ablation is a modern technique available to us that allows us to burn a nerve ending that is generating pain. By burning the nerve ending, it no longer allows that nerve fiber to generate the pain signal to the brain and allowing the patient to become pain-free.
Spinal cord stimulation is another minimally invasive back pain treatment offered at the Pain Management Center. This treatment lets patients adjust their own pain management.
Spinal cord stimulator is essentially a medical electrode that we place close to a spinal cord in the patient's back. While connected to the electrical generator, it alleviates patient's pain. What usually happened, instead of feeling painful sensation in the area of the body, patients start feeling a tingling or electrical stimulation in the same area. And this tingling essentially replaces the painful stimulus.
Having this stimulator implanted has afforded me the ability to be able to do 2-mile walks a day, and I've lost 15 pounds, which is good. And it's a mental release, not having that pain. Having the ability to adjust the level of the intensity of the stimulator for the type of pain I'm having at the time really helps.
The Pain Management Center also delivers new techniques for interventional pain management, such as diagnostic injections and selective nerve root blocks.
As an orthopedic surgeon who specializes in hip and knee replacement, I often see patients who present with lumbar spine pathology with potentially referred pain to their hip and their knee. And often we need to sort out whether it's their hip or their knee that's the problem, or whether they're actually having a pinched nerve root in their back that could be contributing to their hip and knee pain. And that's where these diagnostic blocks are very valuable. We can send them to Dr. Gesquire and have him do a diagnostic block of that level and determine if their pain goes away. Then obviously the problem is in their back and not in the hip or the knee.
If you suffer with back pain, let the experts at the Pain Management Center at Centennial Medical Plaza find the right treatment for you.
I would recommend Dr. Gesquire and his team over here for anybody that's having pain. He just really does a thorough job. It's one of those ones where I've actually had another doctor try this on my upper back, and it didn't work. I've had actually 2 doctors try it. He went in there, he was the 3rd doctor that tried it on my upper back. He went in there and I felt better before I got off the table.
I suffered with back pain about 5 years. I couldn't do housework, no recreation. I had trouble at work. I couldn't sit for a long time, couldn't stand for a long time. So it pretty much affected every facet of my life. Since my treatment, my quality of life it's been so much better. I can function at work, can function at home.
Our future here at the Pain Center is to continue providing patients with the combination of education with the most advanced techniques available.
For more information, visit centennialmedicalplaza.com.